Good evening, and welcome to the Oral Health Regulators Return to Comprehensive Dental Care webinar. My name is Dr. Fern Craiglin. I'm a public health dentist and assistant dean at the Faculty of Dentistry at Dalhousie University. I'm also the part-time dental consultant for the Department of Health and Wellness in the Nova Scotia government. First, a little bit of housekeeping. Attendance to this webinar counts towards your continuing education credits for your respective oral health regulatory board. In the next couple of weeks, you can expect to receive a certificate of attendance via email. The webinar will include a short presentation by each of our oral health regulators outlining the changes in the return to practice documents for stage phase 3, otherwise known as the return to non-urgent care. This will be followed by a question and answer session and closing remarks. Tonight, our panel consists of the registrars and president of our provincial oral health regulators. Dr. Martin Gillis, Registrar of the Provincial Dental Board of Nova Scotia, Stacey Bryan, Registrar of the College of Dental Hygienists of Nova Scotia, Maureen Hope, Registrar of the Denturist Licensing Board of Nova Scotia, and Christian Hall, President of the Nova Scotia Dental Technicians Association. Before we begin with the regulators' presentations, I would like to take a moment to say a few words. On June 5th, our professions were once again permitted to open our offices to provide much-needed emergent and urgent dental care for our patients. This past Monday, June 15th, the 4 oral health regulators released to their registrants the Return to Work Guidelines for the Oral Health Professions of Nova Scotia. This document outlines a plan for the return to comprehensive dental care for all 5 regulated oral health professions in Nova Scotia. The guidelines and protocols stated within these documents become effective as of Friday, June 19th. As you can imagine, what we know about COVID-19 and how to practice dentistry amid a pandemic is rapidly evolving as new literature is being published at lightning speed. Therefore, the documents must be considered fluid and will be updated as required. While the return to practice documents have been produced in collaboration with all 4 regulated oral health professions, and the contents within these documents are more similar than not, each of us as dental healthcare providers must comply with the requirements of our own regulatory body. Should you have any questions or concerns regarding the protocols, standards, or scope of practice, please consult with your regulatory body directly. We have worked very closely with our partners in the Department of Health and Wellness throughout this pandemic. Our professions are the experts as it pertains to oral health matters in this province. However, the reality is that there are some things that are out of our control. Ultimately, the timing and the type of dental treatment to be provided, for example, whether it be emergency versus routine dental care, will be determined by the Office of the Chief Medical Officer of Health. Dr. Strang and his team base their decisions on the epidemiology of disease in the province, as well as the current scientific literature and best practice guidelines. As a public health dentist, I'd be remiss if I didn't take this opportunity to emphasize 2 specific points regarding the documents. First, the documents were written in a manner to encompass all types of dental clinical practice. It would be impossible for us to be able to address every possible scenario. Therefore, we ask that you use your best clinical judgment, as you always do in private practice, as you move into this new phase of treatment. Secondly, please remember that in addition to good clinical judgment, screening remains the best tool that we have to keep our patients, colleagues, and our families and friends by proxy safe from this virus. Please keep vigilant in observing the necessary safety precautions, as well as regularly screening all patients and staff for COVID-19 in order to minimize its spread. The return to regular practice will undoubtedly look and feel much different than it did 3 months ago. I know that this time away has been extraordinarily challenging for both our patients and our providers. Those who work in the oral health professions are truly caring individuals, and it has been quite difficult to not be able to help our patients as we are accustomed to doing under normal circumstances. We have really missed being able to provide high-quality dental care for our Nova Scotians, and we're really happy to be back. Without further ado, I would like to introduce our moderator for the webinar and the Q&A session, Mr. Don Moores, Principal at Temple Scott Associates. Don?
Thank you, Dr. Craiglin. Good evening, everyone. Before we hear from the 4 panelists this evening, there will be a question and answer session at the end of the presentations. In order to participate in that question and answer session, please submit your questions via the chat app in the Zoom, or the chat function in the Zoom app, excuse me. It is located at the bottom center of your Zoom app. You may type questions into the chat function throughout the presentation, but we'll only be dealing with them after all the presentations are complete. This presentation will be recorded and posted via the Provincial Dental Board of Nova Scotia's website within the next 7 to 10 days, so you always can return to it. And if we don't have time to deal with all the questions we received, we'll certainly make every effort to gather and collate the questions and address them through frequently asked questions on the board's website, the Provincial Dental Board's website, as well as other regulators. So with that, I'd like to turn it over to Dr. Martin Gillis, the Registrar of the Provincial Dental Board of Nova Scotia.
Thank you, Don. Good evening, everybody. On March the 16th, the Provincial Dental Board recommended that dental offices suspend elective and non-essential care due to the COVID-19 pandemic. This action was taken by several provincial dental regulatory authorities at that time. On March the 21st, the Chief Medical Officer of Health, Dr. Robert Strang, under the Health Protection Act, ordered dental offices closed except for emergency dental procedures. On April the 1st, due to community transmission of COVID-19, dental emergency treatment was limited to the 8 emergency dental clinics throughout the province. In May, the Phoenix Working Group and its stakeholder advisory group developed protocols for a phased return to practice. The reopening plan developed by the Provincial Dental Board, College of Dental Hygienists of Nova Scotia, the Tourist Licensing Board of Nova Scotia, and the Nova Scotia Dental Technicians Association was reviewed by the Department of Occupational Health and Safety and the Chief Medical Officer of Health. The plan was approved on May 29th. The phased approach would see dental offices reopen on June the 5th for emergency and urgent care, followed 2 weeks later on June the 19th for comprehensive care. This evening, I will highlight the notable changes since the last webinars held on May 29th and 30th, which described phase 2 emergency and urgent care with the new phase 3 comprehensive document. So the guideline changes from phase 2 to phase 3. You'll see that there is a change with the dental procedures definitions, patient follow-up, masks and respirators for performing AGPs, protective clothing, disinfecting treatment rooms for AGPs, Appendix B, the self-screening tool for staff, and the dental treatment consent form for Appendix C. The comprehensive care stage, we've removed the categories of emergent, urgent, and non-urgent because all dental care will be available to our patients starting on Friday. There is still the designation between aerosol generating procedures and non-aerosol generating procedures, and it still remains that there are additional considerations for all dental procedures. But the thing that is absent would be that there's no suggestion to limit water use during these procedures. The next change would be in section 4.1. The previous document was stating that dental offices needed to contact patients 48 hours following their dental appointment to see if they had COVID symptoms or had developed COVID-19. With the new document, the change will be that the dental offices will be asking their patients to contact within 14 days following treatment if they develop symptoms or COVID-19. The next two changes can be described in Table 2. The previous document, when it came to the aerosol generating procedures for the masks, the document stated that it was a fit-tested N95 respirator or alternative. This particular document is a little bit more there's more of an explanation involved. So it says that it's a fit-tested N95 respirator or the equivalent, or a surgical mask and a face shield. The other change would be when it comes to disinfecting treatment rooms for AGPs. The previous document said that you had to have a gown or a lab coat. The new document says protective clothing or scrubs. Appendix B, it's the dental healthcare provider self-screening questionnaire. This states that if a dental healthcare provider has one of the following symptoms as new or worsening, or any of the two risk factors, that they would not report to work, that they would contact 811 and arrange for a COVID-19 test. The other area that we've included in this particular self-screening tool would be that if you have staff that reside in New Brunswick and are crossing the land border to Nova Scotia to go to work, that they're exempt from the need to either self-isolate or quarantine for the 14 days. So those healthcare workers can travel back and forth to work. And the other notable change would be Appendix C in the previous document is not included with this document. This particular document can be developed by dental offices. They can customize it. There is a reference in the NSDA toolkit for developing consent forms. So this would be appropriate in the member services document. It doesn't have to be quite as prescriptive as what we had in the board document. And those are the notable changes. I will pass it back to Don to introduce Miss Stacy Bryan. Thank you.
Thank you, Martin. I'd now like to ask Ms. Stacy Bryan, the Registrar of the College of Dental Hygienists of Nova Scotia, to make her presentation this evening.
Thank you, Don. First of all, I'd just like to start off with a thank you to the three other oral health regulators, Dr. Fern Cragland, Dalhousie University, the Nova Scotia Dental Association, and the NSDAA, who are just one group of the stakeholders that have continued to collaborate with us throughout this process. And I would also like to give a special thank you to the Dental Hygiene Working Group that has worked on behalf of dental hygienists tirelessly throughout this time. So I'm not going to go over the timeline that Dr. Gillis had provided already, because it's essentially the same as dentistry, with the exception that dental hygiene practices, the order for closure was on March 24th. I also won't be going over some of the elements that Dr. Gillis went over in such excellent detail. What I did want to do is remind you that any of the significant differences from the Provincial Dental Board guidelines and the CDHNS protocols are highlighted in red. The majority of the document is congruent. There are very few differences, but dental hygienists are expected to comply with the CDHNS protocols regardless of practice setting. And if we look at the dental hygiene procedure definitions, one of the things that we did keep in ours was the emergency definition, and that is to assist independent dental hygiene practitioners in determining when there was a need to refer to dental practices if something couldn't be managed pharmacologically by either the dentist or the pharmacist, or sorry, the physician. Client follow-up is the same. Table 2 revisions that Dr. Gillis went over. The only difference would be for CDHNS is that the alternatives to N95s when you're providing AGPs is that masks with a full face shield are level 2 and level 3 only. In terms of Appendix B, it's the same, and Dr. Gillis did an excellent job already of outlining that. So Appendix C has also been removed in the main document, as had been alluded to earlier. For dental hygienists, what you will see is that the NSDA's return to practice document is posted in the library. Special thank you to NSDA for providing that document for our registrants for an additional resource. So what I thought we would focus on for the rest of the component is the screening and decision-making process, with a specific emphasis on some of the more common questions that have come in around aerosol generating procedures, or AGPs. So there, as Dr. Cragland had mentioned, there continues to be an emphasis on appropriate client screening, which is part of the risk hazard assessment. And the flowchart that you see in front of you outlines the process that is essentially in place for all of the oral health professions. So when you're doing your client pre-screening, if the client has 0 or only 1 of the COVID-19 symptoms and no risk factors, you're going to treat them in office following the stage 3 protocols. If the client has 2 or more COVID-19 symptoms or any risk factors, if they have, if they're urgent or emergency care, there's going to be a difference for the triage. So if we look at emergency care that can't be managed pharmacologically, you're going to be referring to an emergency clinic that has the facilities to manage that. Or if it's urgent or non-urgent care, you're going to be deferring treatment until the client test results are returned and confirmed negative, or that you have confirmation that the case has resolved. In terms of aerosol generating procedures, it was gone over very well in the last Provincial Dental Board webinar. They're defined as any medical procedure that can induce the production of aerosols of various sizes, including the droplet nuclei. And non-aerosol generating procedures, or NAGPs, conversely, are procedures that have a lower likelihood of generating aerosols. When we look at this list, the example of what would be considered AGPs for dental hygienists, what we did want to note is that not all dental hygienists are competent in the use of some of this equipment or techniques that we've got listed here. And if that is the case, the dental hygienists must restrict themselves from providing those procedures or techniques unless they are competent to perform it, and that it's done in accordance with any of the relevant CDHNS standards or policies. So in terms of the decision-making around aerosol versus non-aerosol generating procedures, as you'll note in our the stage 3 protocols that are coming up, that we're telling you to consider acceptable NAGP treatment options over the AGP procedures. So as Dr. Cragland had emphasized, it is certainly up to each clinician to determine the appropriate procedure that would be needed for each client. And as a regulated professional, you are going to be using your professional judgment, and you're going to be weighing the benefits versus the risks of providing those procedures. When you look at this decision making, as you're trying to determine whether or not you're going to be selecting an AGP or an AGP, this provides you with a perfect opportunity to look at some of the routine processes that are in our offices that may not actually align with best practices or current standards of care. So one example is when you're deciding when to polish. And when I'm talking about polishing in this example, I'm only referring to extrinsic stain or removal of other discolorations on the teeth versus other reasons that you would be doing a prophy's example before bonding or sealants. So when we're looking at weighing the facts, you're going to consider the fact that there is no therapeutic value to a prophy. It's strictly a cosmetic concern, not a pathological condition. It's contraindicated on newly erupted or deciduous teeth. You're going to consider what is the particle impact, particularly immediately after periodontal debridement when the tissues are irritated or inflamed. As well, most individuals do not require a prophy in the absence of stain. So in these cases, you may consider what would other methods to remove the biofilm or stains, such as removing stain with a hand instrument. So we aren't saying that you can perform an AGP procedure. What we're saying is you need to evaluate your decision making. And if you do decide you're going to perform an AGP, make sure that you're about to use the strategies that help to reduce the risk of aerosol exposure. So when we're talking, these are just some of the examples that are in the document that all of our oral health care providers have. Essentially, the considerations are the same in this as stage 2, with the exception of a percentage change to the rinse that we're going to be talking about. And I just wanted to highlight a few of them. So after you select your correct PPE that you're going to be performing for the procedure based on table 2, you will then be ensuring that you're following your proper donning and doffing techniques. And for those of you who it's something a little bit new, or it's been a while since you've done the full donning and doffing, what we would encourage you to do is look at, we have the link to the NSHA video on our website. In the Appendix A of the document, the joint document there, you'll see both the donning and doffing posters. One of the things that I did want to highlight was something that was mentioned in the last Provincial Dental Board webinar, and it's that there's a major point of cross-contamination is when you're doffing your PPE. So make sure that you review the video, the posters that are provided, and you practice that if necessary without wasting your essential PPE. When we get to the next component here, which is about the rinsing, this should be done. It should be a protocol, if possible, for people who can rinse and that there's no other contraindication for that. Then we're going to talk about using high volume evacuation suction and the four-handed dentistry technique. Four-handed dentistry technique is more effective than two-handed use of the high volume evacuation. Some of the research is showing that you can have reduction of up to 90 to 99% of the aerosols if you're proficiently using high volume evacuation with four-handed dentistry. So if we come to the last example on the slide, which is about performing hand scaling versus ultrasonic scaling, that decision to use powered instruments versus hand scaling is based on a variety of factors that includes evaluating the client's specific oral health needs, any complicating dental or medical health factors, the amount and tenacity of deposits, periodontal health, including the pocket depths, and then based on all of those factors and the information that you've gathered, you're going to select the most effective therapy to obtain the desired client outcome. So if after evaluating your client's needs, it's determined that you do need to use powered instrumentation, you will be using a high volume evacuation with an adapter if it's two-handed dentistry or your four-handed dentistry. Saliva ejectors and isolation devices do not offer protection from aerosols for these procedures. And now I'll turn it back to Don.
Thank you, Stacey. I'd now like to call on Maureen Hope, the Registrar for the Denturist Licensing Board of Nova Scotia, to provide her presentation this evening. You're just on mute, Maureen. Sorry.
Thank you, Don. And thank you to everyone for being here this evening as we, as regulators, introduce stage 3 for comprehensive care to your patients. We all know how important this process is, not only for you as a professional, but for your patients as well. As we navigate through the pandemic, this document will continue to be fluid and will be updated as new evidence-based information becomes available. Denture clinics were authorized to provide urgent care on June the 5th. On June 19th, phase 3 will now include non-urgent care. And your professional judgment has been and continues to be essential throughout this stage. Non-urgent care includes relines, rebases, denture cleaning, and new denture fabrication for complete upper dentures, complete lower dentures, partial upper dentures, and partial lower dentures. The recent changes in phase 3 document include management of patients who have had COVID-19. People who have ended home isolation can receive comprehensive treatment. In Nova Scotia, discontinuation of home isolation for patients with COVID-19 occurs at the direction of the Department of Health. If at least 10 days have passed since the onset of the first symptoms, or lab tests confirm that the case is asymptomatic, and the case did not require hospitalization, or the case is febrile and has improved clinically. Patients who have tested positive for COVID-19 and have not yet completed home isolation should not be treated unless life-threatening. And if so, they should be referred to an appropriate dental care center where airborne precautions are in place. Patient follow-up. Even when staff screen for respiratory infection, inadvertent treatment of a patient who is later confirmed to have had COVID-19 may occur. To address this, staff should request that the patient inform the denture clinic, even if they develop symptoms or are diagnosed with COVID-19 within 14 days following the appointment. And lastly, the use of hydrogen peroxide, the use of 1% hydrogen peroxide or 0.5 to 2% propione iodine for rinse purposes for a minimum of 30 seconds is now recommended. I'd like to express our thanks to the Provincial Dental Board of Nova Scotia, the College of Dental Hygienists, and to the Nova Scotia dental technicians for their guidance and support throughout this process. And a special thank you to all those behind the scenes who have kept us on track and Nova Scotia strong. Thanks very much. John?
Thank you very much. I'd now like to call on Christian Hall, the president of the Nova Scotia Dental Technicians Association, to make the last presentation this evening.
Thank you, Don. I'll make it short and sweet. I'd just like to thank everyone again for all their hard work during this time. It's been a great collaborative effort, and it's been really good effort on everybody's part. So I'll highlight a couple of the changes in the new regulations, mainly the addition of this table. So it gives you quick access to find out what PPE to wear in what situation. And within this chart, it would highlight one of the main differences in the new revision, which would be the use of a protective gown, whether it be mandatory or optional, when treating a patient that is either screened positive and or negative for COVID-19. So please refer to this chart to find out what PPE to wear in certain situations. Next, and for patients who have been screened, we would recommend you screening the patients an hour before their appointment. So we would recommend to call the patient and ask them if they've had any of the COVID-19 symptoms, one or more, and or one of any of the risk factors. And if they have answered yes to any of these, we would strongly recommend you delaying the treatment for that patient for that day and inviting them back when they have in fact tested negative for COVID-19. In the chance where you absolutely must see that patient who has screened and or tested positive, then the proper PPE is listed within the guidelines. And also we would use the staff self-screening as the other regulatory bodies have. So again, any employee should ask themselves these questions every day. The symptoms, either new or worsening, and or one of the risk factors. And if they do answer yes to any of these, then they would be advised not to go to work and dial 811. We'd also recommend tracking this on a day-to-day basis so that a report would be available if anyone from health would come and ask, or occupational health. And lastly, we've had some questions from dentists about should you do anything different in terms of sending cases to the laboratory? And our answer is no. What is currently in your NSDA guidelines is perfectly acceptable. The disinfecting of any impressions or prostheses to be sent to the lab should be disinfected. The only thing we would obviously make sure of is that the disinfectant that you're using is actually effective on COVID-19. And also in your IPAC, it does say that impressions should be placed in an impervious bag. So it would be greatly appreciated if that was done to help reduce the transmission of any pathogens whatsoever. So just refer to your IPAC, and that will tell you everything you need to know to send cases to your laboratory. And that's it for me. Thank you very much.
Pardon me, I was on mute. Thank you very much. We'll now go to the question and answer portion of the webinar. We'll have approximately a half hour for questions. Dr. Gillis-Martin, I'll direct the first question to you. There were some changes in the language around masks. So can you elaborate a bit on some of the approved Health Canada alternatives to the N95 that might be considered for AGP procedures or other procedures where an N95 or equivalent is required?
Yes, Don. So there are alternatives to the fit-tested N95. It could be a fit-tested KN95, but that particular mask doesn't have the fluid resistance as an N95 has. So that mask would have to be covered either with a face shield or with another mask. It could be a level 3, level 2 mask. The other alternative would be to wear a level 3 mask with a face shield. So there are alternatives to the previous document for doing aerosol generating procedures.
Thank you. Stacey, I'll direct the next question to you. There have been some questions around AGPs and open concept offices. So could you clarify in open concept offices what the proper procedures are for performing aerosol generating procedures, and maybe elaborate a bit on the open concept, what we mean by that?
Sure. Thank you so much. And this was actually a question that was answered in the CDHNS and the Provincial Dental Board Stage 2 frequently asked questions. The protocols remain the same for Stage 3. So if you practice in an open concept office and what that means is with no physical barriers separating the chairs, and you're performing an AGP, you're going to be treating one client only in that space. This doesn't apply if you're providing an NAGP and social distancing measures are met.
Thank you. The next question I'll turn to Maureen. You did touch on this in your presentation. Maybe you could elaborate. If patients who have tested positive for COVID-19 are seeking treatment, what is the advice and protocol per the guidance document? When can these patients be seen? You're just on mute, Maureen.
After the 10 days have passed since the onset of the symptoms, they can be treated, or the lab tests confirm that the case is asymptomatic, or they didn't require hospitalization, they can be treated with comprehensive care.
Okay, thank you for that. I'll direct the next question to Martin. Martin, none of the 4 documents dealt with settling times, which have been outlined in some other regulators' documents in different provinces. Could you elaborate on why there are no settling time requirements in the documents?
Thanks, Don. And I think this goes back to the previous webinars as well. If you attended those webinars and you recall Dr. Gregoire's slides with hierarchy controls, with the reopening of practices, it's very important for pre-screening and screening to take place. And that is the elimination control to remove those particular individuals that would have COVID or be at risk for COVID from your practice. So that, in conjunction with the administrative controls, which would be the use of high velocity suction, the mouth rinse, rubber dam, and the enhanced PPE are the protocols that would ensure that the care for patients and the staff that are working in those clinics are safe. So that is the reason why we're not looking at settling times. For those individuals that are at risk for COVID or have COVID, they would have to be referred in the case of a true dental emergency to a dental office that's able to take airborne precautions. So those particular clinics would need to take the engineering controls, which would be floor to ceiling walls. They would have to have the appropriate HVAC and settling times taken into account in order to treat those particular patients' emergencies where they have COVID or at risk for COVID.
Thank you. I'll direct the next question we're getting to Christian. What would you advise a lab that received an impression where they were concerned that proper disinfection protocols weren't followed? What advice would you give labs in this situation?
I would suggest that the laboratory call the dental office to confirm if the case has been disinfected, and if not, we would recommend sending the case back to the dental office to get disinfected.
Thank you. Stacey, I'll direct the next question to you. We've received a number of questions, both in the last webinar and in this one, regarding scrubs. So in the document, it says that scrubs are to be changed into at work and changed out of at the office. A number of people have pointed out that there's only one change room or bathroom in an office, and that many people are arriving to work at the same time. Could you comment on that situation and how it relates to the guidelines?
Absolutely. Thank you, Don. You're correct that in our document and all of the other documents, essentially, and our wording is the same as Provincial Dental Board. The other two are maybe slightly different, but it says that dental hygienists or dental healthcare providers must change in and out of their uniforms and must not wear them outside of the office. But when we had been approached by other practices who expressed the concerns that you are stating to us, what we looked at is that if there is a physical limitation, such as the example that you gave, if the dental healthcare provider can wear clean scrubs to the office, if they can ensure that there is nothing that they are doing in between that would cause them to be contaminated or become dirty before they arrive at the office. This still meets the principles that were put into the protocols and our guidelines, and that would have to be written very specifically in your office-specific protocol or plan.
Thank you. What about changing out of your scrubs? Could you just briefly touch on that?
Changing out of your scrubs at the end of the day? Those, sure. Or out at the end of the day, they do need to change out of the scrubs and put them in. If you look at the components for laundering that is in all of our documents, what you're going to look at is you need to make sure that if it's going home, that you're going to be following those principles, so that when you're bringing those your scrubs home or whatever else you're bringing home, and it's going to be brought home in an appropriate manner and then laundered in an appropriate manner as well.
Thank you. Martin, I'll address the next question to you. There were some changes to the screening protocols for dental healthcare providers in the new guide. There's now a situation where you have different screening for symptoms for patients versus office personnel. Could you explain perhaps why that is and reinforce the differences?
Thanks, Don. And those directives came from the Chief Medical Officer of Health. So these are the things that we take into account, and we update documents as we're given direction to do so. So there are differences between how we screen patients and how we self-screen our staff and dental healthcare providers when they present to work. So it's important to abide by those screening protocols, and we do recognize that they are different, but that is the way we have to to operate in our clinics.
Thank you. I'll just pull another question. Okay, here's a question, a scenario. We have a mom with a 60-year-old son who have back-to-back hygiene appointments. She is allowed to stay with him. Is he allowed to wait in the treatment room with her during her appointment? Do you want to address that, Stacy?
I can start, and then if, because I think it would apply to all of us as well, even though it's a hygiene-related question. I think if you look at the table, it clearly says that you try to limit having a second person in there, particularly if you're going to be doing AGPs. They have to be screened to ensure that there can be reasons, and I think it's actually was addressed in the FAQs in both the Provincial Dental Board and CDHNS documents under stage 2. So you're going to make sure that you follow all of those protocols. It is kind of like I was talking about earlier, where this might be the time to assess some of our regular practices and how we're doing things, and is there different things that we could do differently that would make it easier to not worry about having that second person in the operatory at the same time. But if it is necessary, you're going to ensure that you're following all the protocols that are in place. Martin, did you want to add anything to that?
Sure. I think maybe in this particular case where there are 2 patients and they both would have to be pre-screened and screened before coming to the office, that they are meeting the screening criteria. So I tend to think that, there was a question in the FAQs about, if you have an individual with a wheelchair and they're accompanied by a personal care worker, that you would screen both of those individuals, and if both screened negative, then they both could be in the operatory. So I think, this would be a modification of that particular scenario. And I think, when it comes right down to it, clinical judgment and sticking to the principles as to how you're operating, you'll be able to think things through, and maybe these things will become, as time goes on, second nature with scheduling.
Great, thank you.
Thank you. A quick question, this was touched on briefly. Is it required or necessary to wear a gown when disinfecting the operatories after AGPs? Sorry, I should have flagged. Martin, do you mind just quickly taking that?
Yeah, so that was one of the changes, with the document, so that if you're cleaning the operatory now for after an AGP, you don't have to wear the lab coat or the gown.
Sorry, I'm just scrolling through the questions, pardon me. Okay, this is a good point of clarification. I will ask Martin, you to handle it again. So there is no longer a consent form in any of the health practitioner guidelines. Do we still need consent? This is a question that's come up. I think you answered it, but maybe just touch on that.
Informed consent is an important cornerstone of our practice. In the days of COVID-19, we have to have informed consent as well with respect to COVID. The document that we had in the PDBNS version, prior to this document, it was very explicit there. There were, we don't expect, to be so prescriptive with informed consent documents. We don't really dictate what those informed consent documents would look like. So there is a NSDA return to practice tool that dentists can use to develop their own informed consent documents. And the other thing to remember as well is that, in the days of COVID-19, verbal consent is also acceptable. And, even though somebody may not be actually filling out the form or signing it, it is important that in the progress notes that, this is being documented to ensure that informed consent has been done when patients are coming into your practice.
Thank you. Christian, I'll get you to address this next question. You touched on it in your presentation. Just to clarify, are we still required to screen the patient twice, once over the phone, and then when the patient presents for their appointment?
You want me to answer that?
Sure.
In the lab, we would only screen them over the phone. But I think maybe if that's a dental office question, Martin may want to address that. But in the dental lab, we would just screen them over the phone, and then they would wait in the car, and then we would advise them to come in when we're ready for them.
Do you just want to repeat the question, Don, for me?
Sorry. Should patients be screened twice, once when they make the appointment and once during the appointment? Or do they only need to be screened when they present for their appointment?
Yeah, there has to be, the pre-screening, which would be done prior to attending the appointment. And there's another screening which takes place, during the appointment. And again, this would be, I'll get back to the hierarchy of controls, how important it is, for that elimination to occur, because that is the most, useful thing that we're going to be able to do to keep our practices safe is to do screening. So I can't stress enough the importance of proper pre-screening and proper screening for patients that are coming in, and also, the daily screening of the dental health care providers and staff on a daily basis as well.
I'll ask you to deal with this question as well, Martin, regarding AGPs and gowns. So it's a scenario. If performing an AGP, can a registered dental assistant leave the procedure to get something with a gown on? Or do they have to doff their gown, retrieve the product, then re-don a new gown?
Again, these are good questions. And, if you're leaving the operatory, you should be doffing that personal protective equipment. So I think it's important for, when you're setting up the operatory to have the things that you need to perform that procedure there, and to figure out maybe a way that you can get those things that you need in your operatory after the fact, if there's a way that that can be done. But again, I would stress that, operatories need to be equipped in a manner that you're not leaving and having to doff that personal protective equipment, then have to, re-don it again when you come back.
Stacey, this next question is for you. I think you've touched on it, but maybe just to clarify, as a dental hygienist, can our DDS make us take home our gowns each night to wash in our own homes?
I think there needs to be a conversation with the entire office around the protocols, and you'd have to look at what is the capacity at each individual home as well. There may be special considerations, but if you look at 7.6 in our document, I believe it's 5.6 in the dental one, if all of those criteria from where you're going to put your contaminated scrubs in there, and then when you're going to take them home, how you're going to wash it, if all of those can be followed, that is certainly a consideration. But it certainly is, I feel, something that everybody has to have a conversation about when the office is making those protocols.
Thank you. Martin, I'll get you to answer this next question. You did touch on the exemption for staff traveling by land from New Brunswick. What about patients traveling from Newfoundland, PEI, or New Brunswick for a procedure? Do they need to quarantine or self-isolate for 14 days before being seen?
Thanks, Don. And these are very good questions. These are exemptions that are contained in the Health Protection Act. So there are certain criteria. So if you're an essential, worker, you are exempt from needing to self-isolate or self-quarantine. But also if you are a patient that's traveling from outside Nova Scotia into Nova Scotia for an appointment, you do not have to have that self-isolation or self-quarantine period. And I do believe that the order also states that that individual can be accompanied by another person. So I think it's meant for not just dentistry, but I'm sure it's made for, all healthcare that's being delivered in Nova Scotia. So if you had a circumstance where there was a child that needed the treatment, that child could be accompanied by a parent to that appointment without the need for self-isolating.
Next question, I'll actually just ask it and someone can take it. What are the PPE requirements for reprocessing of instruments in the sterilization area? Do you want to take that, Stacy? Or do you?
I can, and then if anybody else wants to jump in, if I've forgotten something, when you're looking at the reprocessing area, you're going to think about things like you're probably going to have heavy duty gloves on there. You're going to have a reprocessing gown. I'm just trying to recall Martin or Christian. I think actually Christian had something written in theirs. Was there anything else you've got that is critical? The mask, I
think that the answer would just, you would follow the NSDA infection control guideline.
Okay, thank you.
Processing instruments, yeah.
I was trying to total blank, my apologies.
Next question deals with COVID symptoms. So if a patient has no COVID symptoms, but does have an underlying high risk like diabetes or HBP, are they still able to be scheduled for an appointment? Mark?
This is where clinical judgment comes in. And, when you have an individual that screens negative for COVID-19 and they have underlying medical conditions, I would say treat that individual like you were treating them prior to the days of COVID. So if you have circumstances where there's an underlying medical condition where your dental treatment is going to have an impact, you may want to do further investigation by contacting their physician or other healthcare providers to ensure that that patient is getting the best care that they can in your practice.
Okay, we have time for 2 more questions. As I mentioned, we will review all the questions that were submitted, and for commonalities, we'll publish a list of frequently asked questions to clarify some of the questions that we didn't have time to get to. At the end of the questions, Dr. Fern-Kraeglin will be providing some closing remarks. Okay, this is a good question. Maybe you can take it, Dr. Gillis. Do patients that have a negative COVID-19 test result get a document stating that?
Well, they are cleared by Department of Health. So the documentation, I really am not certain about. We can find that out though, and we can post it into an FAQ. It's impossible to have all the answers to these questions. So I will find out and we will post it into an FAQ.
And last question, can hygienists use level 1 surgical masks for non-AGPs?
Yes, it was just the AGPs that were the level 2 and level 3.
And Martin, maybe I'll get you to clarify an alternative to an N95 under the dental board guidelines with a face shield. I think you had said level 3 mask earlier, but did you want to elaborate on that? If you're using a face shield under the provincial dental board guidelines, what are the requirements?
Yeah, sorry if I miscommunicate that. It would just be a surgical mask, so it could be level 1, 2, or 3. Sorry about that.
Okay, as I mentioned, this webinar will be recorded for future reference. Should people want to go over it again, we will be trying to answer all the questions that we didn't get to this evening. I'd now like to call on Dr. Ferd Craiglin to provide some closing remarks.
Thank you, Don. I'd like to take this opportunity to express my sincere appreciation to our regulators and their teams, our professional associations such as the NSDA and NSDAA, specialist societies, Dalhousie's Faculty of Dentistry, the IWK Dental Department, the Department of Oral and Maxillofacial Surgery at the QE2, our partners in government, and all of our other stakeholders for their tireless work in producing documents that allow the safe return to oral health care practice in Nova Scotia. The 4 provincial oral health regulators have provided us with a coordinated action plan and profession-specific protocols and guidance related to the safe resumption of care for the 5 oral health professions in Nova Scotia. Much like Premier McNeil and our Chief Medical Officer of Health, Dr. Strang, the oral health regulators have been committed to a safe and phased-in approach, one that's been informed by scientific evidence and best practices. Our approach taken to the return to dental practice here in Nova Scotia has been quite unique. When I speak with my dental public health colleagues from across the country, they've been much impressed by our collaborative process. There are very few provinces that have a unified voice across all of the oral health professions. This will benefit not only our patients, but all of us as dental healthcare providers. While our return to practice won't be without its hiccups, I'm confident that it will be much smoother because of the effort and diligence put forth by our colleagues. Unquestionably, there is still much to learn about COVID-19. Those who have worked on these documents are committed to staying informed with the latest public health guidelines, to review the data, and to evaluate emerging scientific literature to ensure that our protocols and guidelines remain current, practical, but most importantly, safe. And lastly, I want to thank all of you. I can only imagine how difficult it's been over the past 3 months. Thank you for patiently waiting to hear updates and trusting that work was happening on your behalf behind the scenes. I'm sure for some of you that time seemed to have moved very slowly. I want to thank you for providing such outstanding care for Nova Scotians in these exceptional times. As I said earlier, we are in the profession of helping people. We are caregivers and problem solvers. We do not do well when we are not busy doing what we love. Thank you for taking care of your patients in not so traditional and oftentimes frustrating ways. I know most of you spent countless hours on the telephone handling emergencies. You counseled, you reassured patients, many of whom were not patients of record, and I can't thank you enough. I know it's been exhausting, and I want to assure you that your efforts have not gone unnoticed. But finally, the time has come. We can once again feel the satisfaction of truly being able to care for our patients now that we are back in our clinics, and that is a good thing indeed. And lastly, I want to leave on a personal note. For me, one of the positives that has come from all of this is the feeling of gratitude. In my professional life, I feel very fortunate to be able to work with some very talented, smart, and kind individuals. Working through this process has only strengthened this belief even further. As we all venture back to providing oral health care in our clinics, please take the time to reflect and enjoy a renewed appreciation for the care and valuable service you all provide. I know that there are many patients and colleagues too who will be very excited to see you again. So take good care, good luck, and all the best in the upcoming days.